Hi, Mr. Cottontail. My name's Paul. I'm your nurse. Your orders say that I have to do a sterile dressing change. Can I call you Peter? Is that all right? From reading your chart, I understand you had a little fail on the bunny trail. So I'm going to go out, I'm going to get my equipment, I'll come back, and we'll perform your dressing change. Hi, Mr. Cottontail, or Peter, I'm back. I got my equipment. I'm going to be using your bedside table if I may, but first I'm going to need to check your identification. I got to check your armband if that's okay. Terrific. And could you spell your last name for me? Cottontail, great. And your date of birth? Interesting, 5 years ago on Easter. That's quite interesting. Like I said, I'm going to be using your table, so if I can move your phone and your other stuff off it, if that's all right. It is? Great. And I'm just going to take off my lanyard because I certainly don't want that falling and hitting anything. And I'm going to bring that over and clean up my hands one more time. I brought 2 dressing change kits in case I break sterility on one, and I got a pair of gloves here to take off your current wound. And we'll get started. And of course, with any procedure, we need to provide privacy. All right, Peter, I'm gonna get that old dressing off and we'll see what we got under there. I'm gonna put on some clean gloves. And your dressing is still in place there. So what exactly were you doing on the bunny trail there? What happened? Really? What were you carrying? Baskets? Eggs? What? All right, let's get this dressing off. Put that in the garbage. And let's see what we got here. Looks like we got some serosanguinous drainage. Doesn't look bad. The wound itself is well approximated. There's 1, 2, 3, 4, 5, 6, 7 stitches as was directed per the notes left by the surgeon. So what I'm going to do, Peter, is clean this and reapply another dressing. I'm going to get rid of these in the garbage. One more clean. I'm going to open my sterile dressing kit. Off to the side. I'm going to first get my sterile drape out. This will be my sterile field. Be aware that there is a 1-inch border around each sterile field. Then I'm going to put on my sterile gloves. It's important to keep the sterile field and the incision site within your line of vision. These gloves are a little tight, but as you can see, I did get them on. I am now taking all of the sterile equipment I need and placing it on the sterile field, being careful not to break sterility. Any items I do not need, I will be throwing aside. I am placing the cotton tip applicators into the sterile solution prior to cleaning the wound. I am first going to clean down the center of the wound and then down each side of the wound. The wound is well approximated. It's red. There is some swelling or edema, but that is expected as Mr. Cottontail is 2 days post-op. As you can see through this procedure, I am careful to hold my hands well above my waist. Now that the wound is covered, I can now window paint it with tape, and that will be the end of the dressing change. I could take these gloves off, and it'll probably be easier to tape, and I believe that's what I'll do at this time. Peter, any pain? Terrific. You'll be out of here in no time. The last thing I want to do is put a sticker on that documents, grab a pen, and it documents when I did this and the time. It's Easter and my initials, and place that on the dressing so that the next nurse knows when it was done. Then you'll clean up your area. Put it all in the garbage. Stay there. Peter, I'm going to return all your items, your phone, your flowers from all your friends, you know, the tooth fairy and such, your water, and your call light. If you need anything, give me a call. I'll be back to check on you in about a half an hour. Other than that, we are good to go. Do you need anything right now? No, you're not in any pain? Terrific. Then I will see you in half an hour, sir. Thank you. Okay, I just wanted to talk about a couple things that break sterility.
Hey, Paul. There's donuts in the break room.
Oh man, terrific. I'll be right there. First off, never turn your back to a sterile field. It is then considered unsterile. Number 2, never drop your hands below your waist. That's why I kept them up. Number 3, there's water on the sterile field. Unsterile. Those are 3 of the things you need to worry about. And remember, 1-inch border. So if I drop this, unsterile. One more thing, time. You never want to set up a sterile field half hour prior to using it, unsterile. You want to set up that sterile field prior to utilizing it.